TV.square.
Content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We can be reached at 954-717-7027. We are a Medicare certified home health care agency in Palm Beach County, Broward, and Miami-Dade. I am your host, Louise Gomez, and tonight we have Dr. DANE Pohlman, and he has an office in Royal Palm Beach Boulevard in Coral Springs and also in Delray Beach. Can be reached at 754-206-1877. The website is PohlmanPainAssociates.com. Thank you so much for coming, Dr. Pohlman. We really appreciate you
Thanks for having
taking
me.
time out of your busy schedule and coming to join us. Can you share with us a little bit, tell our viewers and our listeners a little bit about your background and your training so we can kind of get an idea of what you do?
Yeah, so I have two specialties. One is called physical medicine rehabilitation. So that's focused on function, and there's a lot of chronic medical conditions that you get trained to deal with. And then I did some subsequent training in pain management. So I did the primary specialty training at Georgetown in DC, and then I went to New York for my fellowship training in pain management, where I learned a lot of different procedures to treat a variety of different painful conditions.
And I feel like you're in the right place. I mean, South Florida, there's an older demographic and people want to be active and they want, to continue to be outside. So you're definitely in the right area. So your specialty is in pain management. And can you tell us, because normally when we think pain management, we think pills.
Yeah.
So can you tell us a little bit more about what your distinction is?
Yeah, I think that's been one of the challenges over the last, however many years, is just trying to get the education out there of what pain management is and what the specialty means, and what's an appropriate, person to be sent to us, and all that. Even amongst physicians, I think it's always been a challenge, but really the focus is on regaining someone's function and keeping people active. So like you said, it's a great fit for down here in South Florida, where we have so many people all year round are trying to be outside and staying active. So anyone, it really is, what else besides pills are a part of it, but there's also a lot of other things we're able to offer now for people to be able to treat different things, musculoskeletal, I think that's the focus. So yeah, and I think a lot of people are not trying to be on medications that are sedating them and making them not able to function. So we have a lot of other solutions now. So
what is the approximate age range of your patients, if you can share with us?
It's actually a pretty wide range.
Okay.
I mean, unfortunately, down here in Florida, there's a lot of car accidents and injuries. So someone that's young unfortunately gets injured, we'll see someone like that. But also even up to, I think, today I saw someone that was 95 years old that, is just trying to, again, have some more function in the activities they're doing. So it's just, it's a good range.
So would I need a referral to see you? Like, would my primary care physician give me a referral and then I get to see you? Is that right?
So we take a wide range of insurances. So some of them do require referral, like an HMO, but if there's, Medicare plans, a lot of them don't require that, or PPO insurances that are commercial don't require referral, and so you can just make an appointment.
Interesting. Okay. So why should a patient see a pain management specialist? Like, if I'm sitting there saying, well, I think I'm in pain, but I've been living with this for years, Why should I see you? Like, what's going to motivate me to get up
Yeah.
and see you? Why should I see you?
Well, I mean, there's a lot of things we have available now for, for the spine, for example. So, whether it's degenerative disc disease or just back pain in general, someone that's trying to.
What is, I'm sorry to interrupt.
Yeah.
What is degenerative disc? I hear that a lot.
Yeah.
And to me, in my mind, I make up that it's just a deterioration.
Yeah.
Can you please give me a little more explanation of what
So
that is?
it's kind of lumped all together, but basically the discs in your spine start shrinking as we age. You lose the hydration in them, and it's a normal process. And not everyone becomes symptomatic, but sometimes you get back pain. Sometimes you get stiffness. It could even turn into something we've heard the word sciatica a lot, which is
I've heard
back
that.
pain going down the leg, and there's a variety of reasons why that can happen. But I think that what you were asking about, when should someone come in? I think that, if you're being limited by something that's painful, I think it's a great time to see a specialist, because what I find every day is that maybe somebody has just been kind of going through the motions for many years and has not really been assessed as to what other options are available. And so, I think coming for consultation, I'll tell this to patients that unfortunately need to have surgery. I'll say, going to see a surgeon doesn't mean you're having surgery. I think, coming in to have a discussion and discuss what options are available is a great option. You come for an appointment and we see what we can do, outside of just taking a pill or something like that.
I love that, because you
Yeah.
give people other options, because if they hear surgery, that can prevent them from
Yep.
saying, I don't even want to do that.
Yeah.
But knowing that there are other options, I believe that people would want to see you to say, okay, well, what are my options? I have this pain in my back for 10
Yeah.
years, and maybe I can, see you and do something about that. I always like to ask this to doctors. Do you see any correlation between diet, lifestyle, like healthy living, and correlation between pain and maybe that type of lifestyle? Or can you speak into that?
Yeah, I mean, I think all these things go hand in hand. I say a lot to my patients that, the body's everything's connected. There's a lot of compensation. And that can also apply to your brain, and psychologically how you're compensating with, depression, anxiety from not being active. And so I think the more active you can be, that your body allows you to be, I think you're going to have a healthier, just, even your psychological well-being is going to be in a better place. So, diet's a part of it. Again, staying active, being out in the community, I think it's a part of it. But again, the people are limited from pain or different conditions. We have to figure out a solution so they're able to do these things.
Right, it's like a catch-22, right? Because it's like, okay, well, I'm limited because I can't go out, I can't do this, I can't do that. But if they see you, I feel like they'll have other options. Do you have any tips for managing like chronic pain, or what would you recommend for people who are having that experience?
I think there's a variety of new things that have been out in the last couple of years. One condition I know a lot of people down here, folks over the age of 65, there's a large population of people dealing with something called spinal stenosis in their spine.
What is that? I've heard that quite a few times.
Yeah, so what I describe it to patients when I see them in the office is that it's kind of like the room collapsing in on your spine. So the nerves are in this little space, and if they don't have room to move around, you'll start beginning to have symptoms. And there's some pretty common things that people will talk about where, we call it the shopping cart sign. You might see someone at the grocery store leaning forward when they're walking. Because what happens is, as that room is collapsing on the nerves, they compensate with this posture of leaning forward. It kind of helps open up the spaces where the nerves are. So, a lot of times people can have back pain. They can have sciatica, which is pain down the leg. They can have walking intolerance. So
What is that?
So like, I'll say to someone, how far can you walk? Can you go to your mailbox and get your mail and come back to the house? What happens when you do that? And someone with spinal stenosis might say, I start getting weakness in my legs. I find myself having to sit down. And if I sit down, it relieves the symptoms. And so not everyone even has pain. Sometimes it's just the walking issue can be a problem with spinal stenosis. And so we have some issues, issues with that with function, but there's some solutions now that we have available in pain management. So, for many years it was the injections, like the epidural injections.
Yes, I've heard about that.
A lot of people have heard about those. and they can help take away inflammation, kind of help with that pain going down the leg.
How long does that last, though? If someone gets an epidural,
It's a great question.
Yeah, how long does that last?
So it depends on each patient's individual situation. I mean, sometimes these shots can last for months.
Right.
Sometimes they help for a couple weeks, and then and that's it. So years ago, the option we had then at that point was to send someone to a surgeon to have a conversation about a fairly large surgery. Now we have other options. There's a procedure that I've been doing quite frequently over the last year. It's called the MILD procedure. It stands for a minimally invasive lumbar decompression. And it's a very short procedure. It takes about 15-20 minutes to do in a surgical center setting. It's not a surgery. I would consider this a procedure.
Is it non-invasive, or is it laser, or how
no?
is it?
It's using a needle, and so
Okay.
you end up walking out with a Band-Aid on your back.
Amazing.
I've even able to do this with local anesthetic in the past for people that can't get IV sedation,
Okay.
whether it's because of the other problems they have, their kidneys or whatnot, and people do fine. So, but generally speaking, you get sedation like you're getting a colonoscopy, that type of sedation.
Like Twilight, right?
Twilight, and then you walk out and you go home, and there's very limited restrictions or anything like that. And my hope is that a few weeks later, you're going to have improvements in some of those symptoms that I was describing, like the walking intolerance, leg pain, back pain, all of that stuff.
So let's repeat that. MILD, which is the acronym
Yeah.
for.
Minimally invasive lumbar decompression.
So if someone is in their home right now and they're saying, how do I know if I think I want to go for that, because
Yeah.
that sounds like something that I might need. If you're speaking to somebody
Yeah.
right now who's saying, I'm going to call you and do this.
Yes.
Like, what would you say to them? Like, what are they experiencing, or
Yeah.
what can you tell us?
Well, the good thing is that, I mean, generally speaking, the people that are going to suffer with this are over the age of 65.
Okay.
And so individuals that are over the age of 65 in this country have generally a Medicare plan.
Right.
Mostly all Medicare plans cover this procedure.
Okay.
And so what I would recommend, if you're experiencing symptoms like this, you come for a consultation. We're going to need an MRI or some sort of imaging study of your back to see the specific anatomy in your back and make sure you're a candidate for this, and to see if it's a possibility. So
You said symptoms like maybe walking slower because they have pain in the back,
Yeah.
or what other symptoms would they be presenting with?
sometimes, again, just limitations in how far you can walk, where you get this kind of just, your legs just don't want to work anymore. You feel like you
Okay.
have to sit down, and generally speaking, that sitting down makes it a lot better.
Yeah.
And then you get up and you move around, and the symptoms are there again, whether it's back pain, leg pain,
Okay.
that sort of thing. And again, it may not even be pain. It may just be the legs just don't want to work when you walk even short distances.
Wow.
And yeah, so it could be an option. I think there are other options we have for other conditions, but I'll tell you, this has been a big one.
I
And
was going to say,
yeah.
that sounds like it's very,
Yeah.
it's something that sounds successful.
And I've had a lot of patients come in to see me. Friends and family have been coming in. People that have tried the injections over the years and, just don't think they work, but they're also just not interested in having a big surgery.
Right.
And so, the nice thing about this is it's very, it's an in and out thing, and the risks are very minimal. And so I think that, I would say about 80+% of patients are getting decent relief from this.
What's
So.
the downtime on that? Like, what do they look, if they have this procedure, what does
Yeah.
it look like to them over the next week or so?
So you could have some soreness from the procedure. I would say a few days of that. Use ice packs. As far as restrictions and limitations functionally, there are really no restrictions. It's
Okay.
just, recovering from the procedure and there's some discomfort for a few days.
I have a question for you,
Yeah.
Dr. Pohlman. What if I know somebody who is playing tennis? They're 67 years old, and they're like, you know what? Something's not right. It's just, I'm not getting the same stretch. I'm not getting the same, and they're feeling a little stiff. And people say, oh, well, you're getting older, and it's just part of
Yeah.
that. What would you say to that particular active person who's
Yeah.
maybe not getting that same type of...
I would say that's a great candidate to come in and,
Right.
and have a conversation because, and I'll be honest, I think over the years it's been tough to get that person in the door because I think they think pain management, they think pills.
Right.
But for that individual, there's a lot of things to start with, whether it's looking at their back and finding they have some arthritis that's been acting up. There's some other things we do in the office, like nerve blocks and things like that we can do to calm this down, that doesn't involve pills. And so, you know, I think just getting established with somebody and being able to have a conversation of what options that are there to keep you out there playing tennis or pickleball or whatever activity you're really enjoying. So,
Right.
yeah.
So, you know, we have one of your, we happen to have
Yes.
one of your patients today, and she believes in you so much. I spoke to her. You actually, you know, have changed her life. And, you know, we'll get to her in a minute as soon as they come on in and they're able to, we're able to turn the camera. But
Yeah.
I know that there's a lot of people who are active.
Yes.
And they want to continue to be active.
Yeah.
And that's really, you know, that's really what it's about. People want to be active. People want to have that same, you know, they don't want to believe in the old story of, well, I'm just getting older. And so, yeah, we want to interview Wendy, and we're going to give her a mic in a minute. And I think she has an amazing story. So we're going to turn the camera to her in a minute. Yeah, Wendy, welcome to the show. I'm so grateful that you decided to come in and share your story. And you know, just from seeing it, meeting you for a minute, I'm like, you look like a very healthy, active, you know, woman.
And I used to work out 3 hours a day.
Wow.
So, and I'm a golfer. And so I had a very active life, but I have spinal stenosis, and then I had a bulging disc and 2 pinched nerves. And I had tried the epidurals, and they didn't work, and they were very painful, and I had given up hope. And then I was so bad that I was in a wheelchair for 3 weeks.
Wow.
And for an active person to be stuck in a wheelchair was awful. And then I had heard about Dr. Pohlman, and I went in to see him, and we discussed what the options were, and we went with a mild procedure. And I have to say that I'm back playing golf, and I am back to my exercise classes. I think that with also I've done physical therapy, which has really helped. I use Stern at home physical therapy. They helped me start building my inner core. But the big release has been having the procedure. And I have to tell you, I'm a chicken. I already told him when I went on the operating table, I'm a real chicken. So just, you know, be easy with me. And I have to tell you, it was painless, really. I went to sleep, I woke up, it was over, and a little sore for the first couple of days, and you know, iced it and everything, and I've worked my way back to playing golf, and today was, well, actually yesterday was my first day at golf, so it was exciting.
Congratulations. So I have a question. You said you have spinal stenosis. So what was your, what were you experiencing?
Well, I had spinal stenosis, and I also had sciatica. And the sciatica was what, you know, when I first came in, I said that's really where the pain was coming from. And I had had an MRI, so Dr. Pohlman was able to see it. And then we discussed what were the options. You know, there are other ways, like an ablation, which I know that you do, but this was the least invasive. And since I really wanted a quick recovery, this recovery was incredible, how fast. I mean, I was basically back at work a week later.
I think one of the big things is just when people come in, like when Wendy did, is just kind of looking at the whole situation. And like I said before, there's a variety of things we have available. The mild was a great option for her. But, you know, there's other things that can be going on too that might have, you know, maybe another solution would have been different for a different patient. So, but yeah, it's been a great outcome, and, you know, seeing a lot of that. So it's good.
Yeah, so we're going to take a commercial break, and then we'll be back to ask a few more questions. But
Sounds
it's
great.
been so informative. This is great stuff. So yeah, we'll be back in a minute, taking a commercial break.
Okay.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor. We have Dr. DANE Pohlman, who's right here in Coral Springs as well as in Delray Beach, Florida. And his phone number, you're going to want to write this number down after this conversation. It's 754-206-1877, Pohlman, PainAssociates.com. So, Dr. Pohlman, Wendy mentioned something, and
Yeah.
I've heard that a lot. And can you please tell us a little bit more? What is that, ablation? I've heard that.
So earlier you had mentioned this kind of fictitious patient that's a very common patient,
Yeah.
the person playing
Yeah.
tennis and has some back pain
Right.
that, described as stiffness, and it just doesn't go away, and that sort of thing. So I'll get a lot of patients coming in that complain of back pain that doesn't really radiate down the leg. It just stays in the back. Described as more mechanical, like you move around, it hurts, it's stiff, and so once we do evaluate this, we find that a lot of it times it's arthritis. So people get arthritis in the back. In your back, we have these little joints. They're called facet joints, and just like you have a knee or a hip joint, they're these little joints, and that's where you get the arthritis in our back. So there's actually a little nerve that goes to those joints. So what we do is typically we'll do some nerve blocks of that specific nerve that goes to the joint in the low back in the office.
Nerve block meaning like an
In the
epidural?
office. Yeah,
Or, so it's in office.
So it's like the epidural. We use a machine to guide
Okay.
where we're going to go. So it's a big live X-ray machine
Okay.
to target this area in the low back, and we do the nerve blocks. And if it's successful temporarily, then we'll come back and do the ablation. Which the ablation is the same thing, but we're able to put energy by that nerve through a needle and basically damage it so it doesn't provide that signal of pain, and it can last for about 6 to 12 months.
So it's disrupting the pain signal.
Yes.
Oh, I like that.
That goes to the arthritic joint in your back. So, it's a lot of description there, but it's pretty straightforward. And the other issues with the epidural shots, which again I found, it sounds like I'm being negative on epidurals, but epidurals can be great for the right patient.
Sure.
But I also will get some people coming in the office that have other conditions like heart problems that they're on blood thinners,
Okay.
or they'll have diabetes and their blood sugars
sure.
can go up. So the nice thing about the ablation also, it's not something I have to use steroids for.
Okay.
So blood sugars are stable and all that, and it can help back pain for a long period of time. So we'll do this a lot for people with arthritis in their back.
So people have options, right?
Options, yes.
It's options.
That's the key.
And that's what I like, because
Yes.
it's not like years ago it was like, okay, you need surgery. It's like, no, we
Yeah.
have options. So thank you so much for sharing. And I'm just so grateful that we also had a testimonial for one of your patients.
Thank you very
So
much.
I appreciate you for coming on. We have Dr. DANE Pohlman. He can be reached at 754-206-1877, offices in Delray Beach, as well as Coral Springs. Feel free to reach out. You have options. You don't need to be in pain anymore. So
Thank you very much. Thank you.
Thank you, absolutely.